You've probably heard that heart trouble screams with crushing chest pain, but for many adults over 50, the body whispers first. Soft clues in your energy, your breath, your legs, your jaw. Tonight, we'll lay out 7 subtle warning signs you can notice in everyday life, and for each one, I'll tell you what to do next, so you don't have to guess. We keep this plain English, grounded in reputable research. According to the American Heart Association, especially for women, early symptoms can be confusing and easy to downplay, which is why knowing the quiet signs matters. Number 1 is pressure, tightness, or a strange squeezing across the chest that comes and goes, often during activity or stress, and then settles when you rest. In simple terms, your heart is a pump that needs oxygen. When the arteries that feed it get narrowed, the muscle may complain with pressure rather than dramatic pain. Why it matters is that this pattern can be angina, a sign that blood flow is limited, and sometimes it isn't just a warning. Sometimes it's an early heart attack. The American Heart Association explains that chest discomfort can feel like pressure or fullness, and it may spread to the arms, back, neck, jaw, or even the upper stomach. What to notice is timing and triggers. Did it start with walking uphill, carrying groceries, or an argument? Did it improve within minutes of rest? What to do is simple. If this pressure is new, severe, or lasts more than a few minutes, or if it keeps coming back with shortness of breath, nausea, clammy sweat, or lightheadedness, call emergency services rather than driving yourself. The common mistake is waiting it out, assuming it's just indigestion or trying to sleep it off. A soft bridge to our next sign. Sometimes the chest is quiet, but your breathing tells the story. Number 2 is breathlessness during light activity or the need for extra pillows to sleep comfortably. If walking across the room or climbing a short flight leaves you unusually winded, or you find yourself propping up with 2 or 3 pillows to avoid that smothered feeling, that can be a circulation issue where the heart isn't keeping up and fluid backs up toward the lungs. Why it matters is that shortness of breath with exertion or when lying flat is a classic heart failure sign, and heart failure can be subtle at first, showing up as reduced stamina or nighttime breathlessness rather than an obvious crisis. Mayo Clinic notes that shortness of breath with activity or when lying down, fatigue, reduced ability to exercise, and a cough that lingers can be early clues. The American Heart Association adds that needing several pillows to breathe easier is a common tip-off. What to notice is the pillow count, whether you wake at night gasping, and whether your oxygen or heart rate monitor flags anything unusual. What to do is track the pattern for a week, time of day, what you were doing, and how quickly you recover, and make an appointment. But if you're suddenly very short of breath, especially with chest pressure, bluish lips, or pink frothy sputum, that's an emergency. The common mistake is blaming it on getting out of shape and ignoring the nighttime part, which is often the most telling. Soft bridge. When the heart struggles to move fluid efficiently, it can show up lower down too. Number 3 is new swelling around your ankles, socks leaving deep marks by day's end, or a shiny look to the skin on your shins. What it is, your body is holding on to fluid, and gravity pulls that fluid toward the lowest points. Why it matters. While ankle swelling has many causes, including vein issues, heat, and some medications, persistent, pitting swelling can be a sign that the heart's pumping power is reduced and pressure is backing up into the veins. Mayo Clinic lists swelling in the legs, ankles, and feet, and sudden weight gain from fluid as key signs that deserve attention. What to notice is whether pressing your thumb into your shin leaves a dent, whether your shoes fit tighter in the evening than the morning, and whether your weight is creeping up 2 or more pounds overnight or 5 pounds in a week. What to do is check your salt intake, log your daily morning weight after using the restroom and before breakfast, and schedule a visit to review the swelling, your blood pressure, and your medication list. The common mistake is assuming leg swelling is always just age or only a vein problem. Treating veins alone won't help if the heart is the source. Soft bridge. Sometimes the sign isn't visible. It's the way your energy fades. Number 4 is unexplained fatigue that feels different from your usual tired. This isn't the normal end-of-day slump. It's a heaviness that shows up doing light chores, a need to sit down halfway through the grocery aisle, or a sense that your get up and go simply left. Why it matters is that the heart supplies oxygen to every tissue, and when supply and demand are mismatched, because of narrowed arteries, rhythm problems, or fluid overload, fatigue can be one of the earliest clues. The American Heart Association notes that unusual tiredness and weakness can be a heart attack symptom in women and can appear days or even weeks before other signs. What to notice is the pattern. Do you feel fine at rest, but wiped out with simple tasks? Has your usual walk halved in distance? What to do is rate your fatigue from 0 to 10 each day for a week. Note what you are doing and bring that log to your clinician to discuss whether further checks like blood pressure trends, a rhythm strip, labs, or an exercise test make sense for you. The common mistake is chalking it up to stress, caregiving, or poor sleep and never revisiting it. Soft bridge. If your fatigue is paired with a sense that your heart is fluttering or skipping, pay attention. Number 5 is palpitations, an odd flip-flop, racing or pounding you can feel in your chest or neck, especially if it's irregular, lasts more than a few minutes, or brings shortness of breath or dizziness with it. What it is, your heart's electrical system is the metronome that keeps a steady beat. When it misfires, the rhythm can become fast and irregular, as in atrial fibrillation. Why it matters. Atrial fibrillation becomes more common with age and can raise stroke risk because blood may pool and form clots in the heart's upper chambers. Cleveland Clinic explains that common symptoms include feeling your heart race or skip, shortness of breath, fatigue, and lightheadedness. Some people feel nothing at all, which is why noticing patterns matters. What to notice is the context. Did it start after caffeine, alcohol, or illness? And what your pulse feels like at your wrist, steady and fast, or irregularly irregular. What to do is sit, breathe slowly, and time the episode. If it's your first episode, if it lasts more than a few minutes with symptoms, or if you have chest pain, fainting, or severe breathlessness, seek urgent care. The common mistake is assuming it went away so it's nothing, and never mentioning it at your next visit. Short phone videos of your chest or neck during an episode, or a written timing log, can be surprisingly helpful to your clinician. Soft bridge. On the topic of dizziness, let's talk about what happens when you stand up. Number 6 is lightheadedness or near fainting when you rise from bed or stand after sitting, sometimes with a quick racing heart. What it is. When you stand, gravity pulls blood toward your legs. Your vessels and heart should tighten and speed up briefly to keep your brain supplied. If that response is sluggish because of dehydration, certain medications, or autonomic changes, you can feel woozy, and if it's severe, you can pass out. Why it matters. While many episodes are benign, a drop in blood pressure on standing, called orthostatic hypotension, can lead to falls, and in some cases, dizziness on standing can overlap with heart rhythm problems or valve issues that deserve assessment. Harvard Health advises that fainting or near fainting when standing, especially if you actually lose consciousness or fall, warrants prompt medical attention. What to notice is whether the sensation is brief and predictable with standing, whether you're on blood pressure pills or diuretics, and whether you've been sick or not drinking enough fluids. What to do is sit back down safely, hydrate, and check your blood pressure seated, and then, if safe, after standing for 1 and 3 minutes, recording the numbers to share at your appointment. If you pass out, have chest pain, or the dizziness is prolonged or severe, seek care urgently. The common mistake is shrugging off a faint as just getting up too fast and missing a treatable risk for falls. Soft bridge. Our final sign is the one most people miss because it doesn't feel like the chest at all. Number 7 is discomfort in the jaw, neck, back, or one or both arms, or a heavy pressure-like indigestion feeling high in the stomach. That doesn't match your usual heartburn. What it is, the nerves that carry pain from the heart and the skin overlap, so the brain can misread where the trouble is coming from. You feel it up here, even though the strain is in the heart. Why it matters is that many people, especially women and older adults, present with these atypical areas during a heart attack and delay care because it doesn't match the movie scene crushing chest pain. The American Heart Association lists arm, jaw, neck, back, and stomach, discomfort, shortness of breath, nausea, and cold sweat as warning signs. A review in the medical literature explains how heart pain can present without chest pain at all due to nerve pathway convergence. What to notice is any new, unexplained pressure that spreads or builds with exertion. What to do is respect the pattern and call emergency services if it persists beyond a few minutes or is paired with breathlessness, cold sweat, or a sense of alarm. The common mistake is chasing antacids for an hour while the clock is ticking. Soft bridge to our wrap-up. Now that you know the whispers, here's how to act on them with calm and clarity. Your practical 3-step plan starts with tracking because patterns tell the truth over days better than any one moment. Step 1. Pick one sign that sounded familiar, maybe the pillow stacking, the ankle swelling, or the flutter, and log it for 7 days. Write down when it happened, what you were doing, how long it lasted, and anything that helped it settle. Add an easy 0 to 10 severity rating and any pulse or blood pressure readings if you have a cuff. Step 2. Adjust based on your notes. If shortness of breath clusters at night, elevate the head of your bed, avoid late salty meals, and stick to a consistent bedtime. If palpitations follow an extra glass of wine or a big caffeine day, scale those back while you're being evaluated. If ankle swelling is creeping up, check your socks and shoes earlier in the day and look for hidden sodium in canned soups, deli meat, and restaurant meals. Step 3. Bring your log to your clinician or pharmacist and ask 3 focused questions. Could this be heart-related for me? What simple tests are reasonable? And what should I watch for while we sort it out? A few simple checks like a blood pressure trend, EKG, basic labs, or a walk test may give clarity without a full workup, and the record you kept sets you up for a more personal plan. Let's recap in one breath so it sticks. Subtle, repeating pressure that spreads or returns with exertion is never just heartburn until a pro says so. Breathlessness with small tasks or when you lie flat deserves attention, and swelling ankles plus a rising morning weight can be your early fluid alarm. Unusual fatigue that doesn't match the day, fluttery or irregular beats you can feel, and dizziness or near faints on standing are all patterns worth logging. And pain in the jaw, neck, back, arms, or a heavy upper stomach indigestion that doesn't behave like your usual is a heart signal until proven otherwise. The goal isn't panic, it's pattern recognition and timely action. If you found this helpful, subscribe for more clear, evidence-informed guidance tailored to life after 50, and share this with someone who keeps saying, it's just age. If you're watching midweek, I recommend our piece on foods that may support your heart after 50 so you can pair knowledge with your plate. And for next Monday, watch our video on early heart symptoms you shouldn't ignore. Hearing those signs side by side with today's list will help you connect the dots and feel ready to act. This video is educational and grounded in reputable research. It doesn't replace your clinician's guidance. Never start or stop medications without professional advice.